Welcome back to Module 3, Part 2 of Altered Oxygenation Respiratory. Let's talk about some of the care of the patients requiring oxygen therapy. I'm going to show you like a 30-second video regarding CPAP and see if that helps you understand it a little more. Our nursing responsibility for the CPAP when patients are in the hospital is to make sure that it fits snug around the nose and the patient Velcro straps are in place. And of course, teaching. Also, we have our tracheostomy. Our nursing responsibility is to keep the area clean, know what size trach you have, keep the Velcro straps intact, and clean the inner cannula. I do have a quick video for you. It's about 2 minutes regarding the tracheostomy too. This short video is only 2 minutes and 48 seconds. That was a great video, but I also wanted to touch more bases on the assessment. I talked about assessment in module for module 3 part 1, but I wanted to make sure I didn't forget anything. So when we get our patient history, listen to your patients, see what they're talking about, listen to them. Listen to all the things. They're having difficulty at night sleeping, they're coughing, they're short of breath. All those things are pertinent information. Use your assessment skills that you've learned, listening to the lung sounds, observing sputum, looking at the work of breathing, looking at your vital signs, looking at your labs. All of that is part of your objective data. The chief complaint, look at past or present occurrences of abnormal respiratory signs and symptoms. They may have been hospitalized several times. Also, health perception, their activity, sleep, rest, all of that is important, and you wonder why they're feeling so tired. They may not be sleeping well at night, or not getting enough rest, or any bit of an activity is a really wear and tear on their body. Look at their nutritional levels, see what they're eating, their hydration, their elimination, and also their lifestyle. Also, with the assessment, we talked about this earlier, but I just want to make sure I didn't forget anything. You have your vital signs, you know, to do all of those things. Inspect, palpate, percuss, and auscultate. Look at your medications, your recreational drugs. We spoke about that in the classroom. I just wanted to reinforce that. And then also, if they've been out the country, you want to ask them, have you lost weight? If you're having any night sweats, any blood in your sputums, those things are very important. Allergies, seasonal allergies. A lot of patients have upper respiratory infections or sinus infections. And once again, reinforcing that cough again. And then we're going to talk about some oxygen. As we talk about oxygen, this is the FiO2 delivered. This is very important. I will cut this area out right here for your nasal cannula, so you'll know how much percentage of oxygen your patient is getting. Okay, that is very important. Also for your simple mask, it's good to know how much oxygen your patients are getting. So now you know when we go up to 6 liters per minute for nasal cannula, patients getting about 44% of oxygen. Look at your nursing interventions, and also start looking at the percentages for the different masks that are going on. Okay, this is important to know about your liters and how much O2. Know that here it is at 1 to 6 liters, and then you just keep going down to 24%. Okay, alrighty. Please read this area and also know what percentage of room air oxygen is. And it's right here. Oxygen is diluted with room air, 21%. Please go to the Skills Lab if you have any questions regarding nasal cannula or even your face mask, as well as your partial rebreather mask. And then also you have your, coming up soon, if I can get this to work right, you have your non-rebreather mask. And I'll try and get it in a box so you can see it a little better. It's your non-rebreather mask. It's better to hold it in your hand and look at it. The picture doesn't give it justice. Please know these terms: orthopnea, paroxysmal nocturnal dyspnea, as well as dyspnea and hemoptysis. And then as you read these definitions, what they are, I wanted to reinforce about oxygen delivery and our patient-centered care. Make sure we do education on what the patients are getting. Make sure we look at their nose. Make sure they're not having any skin breakdown behind their ears, in their nares. Make sure we put an ointment on there so patients are not getting any skin breakdown. Making sure home safety. Make sure they're not smoking around oxygen. Explain to them about combustion and oxygen, which is also located in your chapter. Also, just do a lot of education. Some patients have extended cords when they go home too. Make sure they don't trip and fall over the cords. Some wear the concentrators. So make sure that they understand how the concentrators work. A lot of education for patients when they're going home. Here are more terms to know, but I'm going to show you a quick couple of seconds video on chain stokes. So make sure you read it. Respirations become deeper and faster than normal, followed by a slower rate and progressing periods of apnea. Here we go. I hope that video helped. I want you to look at the alterations, pursed lip breathing, tachypnea, and so forth, tripod positioning. Okay, and make sure if you have any questions on these, you can ask. I want you to, when you do your assessment, look at their respiratory effort, look at the color of their skin, see if they're cyanotic, look at their fingertips to see if they're clubbing, decrease oxygen, if they're using any accessory muscles at all. Okay, and if when simple, getting short of breath with activities of daily living. Look at this picture, and this is what I'm calling clubbing. Here's your regular, and then you see how it goes over. Patients having decreased oxygen. Look at this video and see some of the age-related changes. And also in your chapter, it does state that many additional respiratory changes in older adults results from hereditary and lifetime of exposure to environmental pollutants like cigarette smokes, bacteria, industrial fumes, and irritants. I believe we spoke about that earlier too.